Welcome back to this edition of Dufferin Life. Thank you so much for hanging on. We were discussing, or I happened to mention, that October is Breast Cancer Awareness Month. We have a lovely lady joining us today, Dr. Alexandra Ginty. She is a family practitioner, but she also works with the Cancer Regional Program. Thank you so much for joining us.
Thank you. Yeah, nice to be here.
It's wonderful for you to be here, because one of the things that we really talk about on the station, and what I really thrive to do, is help create awareness. And yes, people have heard of breast cancer, but I think that there's a few points we're going to cover today just of how important it is for testing.
Yes, yes.
So how prevalent is breast cancer in Ontario?
You know, it's a very common cancer. In people's lifetime, they have a 1 in 8 chance of getting breast cancer.
Wow.
That's their whole lifetime. But in the typical year, there's about 12,000 cases of breast cancer. It's a lot, and there's about 2,000 of those will die. So it's still a very serious cancer.
It is, and we're finding it early is the key.
Yeah,
I think that's important with any type of cancer, is obviously finding it early.
Yeah.
But let's talk about how important screening is.
Screening's really important for so many reasons, but there's different types of screening. What everyone thinks of as screening is your average risk person. Mm-hmm. That's screening mammograms between 50 and 74. Mm-hmm. Every 2 years, and what we're trying to pick up is early and otherwise non-detectable cancers.
Okay.
Ones that are so early that we can do something about them with very little treatment and very little what we call morbidity, meaning side effects.
Okay.
And with many of those, we hope to save lives. I won't say all, but for many of them, we hope to save lives. Now, the other side to screening is picking it up early means that you don't get as many chemotherapy treatments. Mm-hmm. And from chemotherapy come late and lasting effects, fatigue, cognitive impairment, some of the neuropathies, and work lost, and so on. So there's so many reasons why early detection makes a big difference in people's lives.
Absolutely. Now, would you say, I mean, we've all been through a heck of 19 months of COVID-19 and the pandemic. Has the amount of people that normally get tested for breast cancer dropped because of that?
Sadly, yes. There's many reasons. We've had about a 40% drop in mammograms. There's many reasons for that. At first, we actually felt that screening was an unnecessary procedure and it was the first to be cancelled. We now know better, because out there we have thousands of cancers that are now undetected. There's other reasons. Patients have been scared about catching a virus in the hospital, where they perceive that it's very prevalent COVID. However, those are other areas of the hospital. They're not usually diagnostic imaging. And then the other reason, which is very important, is that many patients feel more comfortable with somebody with them to have a mammogram. It's a very invasive and private procedure, and they feel very comfortable having a loved one with them. And as you know, in COVID, we've stopped having any partners in the hospital.
Right.
So for so many reasons, including fear and all these barriers, it's been a significant drop in. I'm very concerned.
Yeah, and I think it's very important, because we have to realize that the pandemic is not going to stop cancer from progressing. Nope. So we don't want to stop all of the regular things we do to take care of ourselves better. I know. It's so important.
Yeah.
And I mean, I'll be honest, they called and said, do you want to come in? And I said, we'll put it off.
Yeah.
But you know what? After today, I'm not going to put it off
Yeah.
anymore.
Yeah.
But, and that's why we're here.
Exactly.
Is to make people realize
Yeah.
the importance of being screened and being tested.
Yep.
Now, when you were mentioning the ages in between 50 and 74, but there are still so many people who have breast cancer at a younger age.
Yes.
So how do we convince those people that it's important to test?
You know, there's several different layers there. There are those people that have a family history. It's so significant. I have a BRCA gene, and mine's a very significant family history. We would qualify for that high risk OBSP. And if you're not sure, you ask your doctor, and then they will send you to the genetic screening, and you'll go through some testing. They put you through some rating scales, and it's a scoring system that comes out with whether you should be in a high-risk program. The high-risk programs start at 30, and they go to 65, I understand.
You have the ability to self-test, like to do your own self-test at home. So if you feel something that's unusual, do not wait.
Well, I tell people to give their breasts some TLC. Touch, look, compare. So it's not a formal breast exam advice anymore, actually, but to be familiar with your breasts with some TLC, touch, look, compare, is a very good way of remembering how to look after your breasts. And that can be any age, typically once a month. But just giving yourself some familiarity with your breasts and coming to your doctor if there's anything you think is unusual. And we'll take it from there.
And I think that's the important thing that I think people realize. They're like, oh, do I feel something? Oh, maybe not. Or you're scared. Oh, maybe I've, but that's the important time to go to your doctor and say to them, I think this is, I don't know for sure, but I think this is different.
Yeah, you don't have to be worried. You know, we'll reassure you. Sometimes we'll put you through some tests, sometimes we'll see you back, sometimes we'll have another opinion, but we'll always reassure you.
Yes.
You know, I think it's a priority that we make sure that every stone is always uncovered and that we get people tested appropriately.
Absolutely. Where can people find more information about getting tested?
Cancer Care Ontario is the best website really to get these things, but their family doctor is also a great resource.
Right.
They're kind of the hub of knowing all about this type of thing. If they have a primary care physician or even a nurse practitioner who they are, or even a health program, or schools, their churches sometimes, and even good friends can sometimes direct you in the right direction.
Absolutely. And that was cancercareontario.com, correct? I believe so, yes. .ca.
.ca.
I apologize, it's cancercareontario.ca. So you can get lots of information as well as all of the lovely suggestions that Dr. Ginty has shared with us to get more information about it. And we're just here to encourage you to be aware. And to be diligent in taking care of your own health, and that's what we do when we're creating awareness, is just giving you as much information as we can, and then you take that information and take care of yourself and those that you love, and pass on that information. If you already know this, pass it on to somebody else.
I know. Yeah.
I think that's so important.
Yeah.
So let's talk a little bit about your experience with breast cancer, if you don't mind.
Yeah. So I am an advocate and I'm passionate about this because I went through bilateral breast cancer, and it was on that journey that someone flagged and said, this is unusual, you should be tested. And I came up with a BRCA1 gene like Angelina Jolie. So I fell into a very high risk category. And I picked it up, I wasn't 50, and I picked it up by myself. And I think what really saved me was very aggressive surgery with great specialists and chemotherapy and good follow-up. And I think, you know, voicing that as soon as you have a concern gets you into a really good cancer program, and we want to get the best care. And it was a hard journey.
No doubt.
You know, some of the hard things I have to say was, you know, going through four and a half months of chemotherapy, well, you know, double mastectomy, an axillary dissection, another axilla was biopsied, and then, you know, I had to have the chemotherapy and then Of course, I had to immediately have a hysterectomy because of the ovaries, because
Right.
when you're a BRCA1 carrier, you have to have your ovaries out as soon as possible. And then on to anti-estrogen therapy.
My
so you can
goodness.
imagine the slash in estrogen. So I wasn't a happy person. Yeah.
No, and I think, I mean, it says something a lot about your personality, and I applaud you for, you know, going through all of that and then being willing to share the story with everyone, and then of course being aware of, you know, and just being out here to promote the awareness.
Well, you know, I just have to say, nothing makes you a more passionate advocate than when you discover something about yourself. And it was actually the mental health part of survivorship that threw me. We don't realize how much anxiety and depression play in trying to survive, the fear of recurrence and all the rest that comes with survivorship. So I think that played a huge role in me being the person I could be for all the other people out there who are in survivorship.
And you know, and it's important to have a support system as well, right? So, and if you don't have that support system, you have to reach out to those support groups. Like I always have this thing about people being alone, especially in the past 19 months through the pandemic, and not knowing and not being afraid, and being afraid and not having that support for that mental health to allow you to be strong enough to deal with everything.
Yeah, reach out to your friends, reach out to Wellspring, reach out to your regional cancer center, to your primary care provider. You know, we have the answers, we can help you. And even if you want personal psychotherapy, your primary care provider is very good. You know?
Yeah, and I think that's just, I mean, it's important to be checked. We've already talked about that and why it's important to be checked. Why you should be diligent with your health. It's about the quality of your life, and the quantity of your life, all put together, and you want to have lots of both.
Yes. Yes. Exactly.
And that's why we're doing what we're doing here tonight.
You want lots of both.
Yeah.
I'll go for that.
Absolutely. Well, Dr. Ginty, I want to thank you so much for joining us and helping us to increase the awareness for Breast Cancer Month, but Breast Cancer Awareness Month, but also it's a year-round thing. So
it's a year-round thing.
And thank you so much for joining us.
Thank you.
And thank you for joining us. And until next time, bye-bye for now.